Hey, it's Chris Dewey. You have chosen the selection for you're on a Medicare Advantage plan and you're looking to move into a Medicare Supplement plan. Unless you're in a certain state like New York, Connecticut, or Vermont, certain steps have to be taken in a certain order. And the first step that we have to do is we have to apply for a Medicare Supplement. Look, we're going from a Medicare Advantage to a Medicare Supplement. And if you've had the Advantage plan for more than 12 months, we got to go through underwriting, all right? And it's basically some health questions. Every Medicare Supplement carrier has different underwriting standards. And really, it's my underwriting field expertise, field underwriting comes into play. Because if you got diabetes, I know where to pivot to. I know which company to use. If you have some heart issues, I can go this way. So what I need to know is, let me find the right company for underwriting, and we'll apply for Medicare Supplement. That's step one. Step two, we got to wait for approval on Medicare Supplement because you sure as heck don't want to drop your Advantage plan until you know you got approval on the supplement. Otherwise, you're up the creek. Time frames are really important. We're going to get to that in a minute. Step two, we need to get approved for a Medicare Supplement to start at a date at a point in the future. Then and only then do we apply for a Part D standalone drug plan to go with the supplement. That's the trigger, the drug plan. That's the trigger that stops your Advantage plan, because with Medicare doesn't allow, the Center for Medicare Services, they'll let you have a Medicare Advantage plan with your prescription drug built in, or you can get a separate standalone drug plan to go with your supplement or with traditional original Medicare. So you can't have both. You can't have a Medicare Advantage plan and a standalone drug plan. All right, so when you sign up for the Part D drug plan, that automatically cancels out the Medicare Advantage plan. But we don't want to do that or stop your Medicare Advantage plan until you're first approved with the Medicare Supplement. And unless you're in those certain states that I talked about, you're going to require underwriting. All right? So here's the timing of it. And here's why it's critically important that you don't get out of the Medicare Advantage unless you are approved for a Medicare Supplement to take its place. That'll bring you back to your original Medicare with a standalone drug plan, customized just for you and your listed drugs. And a couple things need to happen in the following order. All right, so if you want to do it by January 1st, the effective date or when the policy is active, we would have to have underwriting approval by December 7th. You miss that period, millions of people throughout the country are switching plans, trying to get supplements. It's a busy time, and everybody panics. They see the commercials. Act now, last day before, a couple days before December 7th is over with, and you have to wait till next year. No, if you miss that period, there's another period that starts January 1st. January 1st starts the open enrollment period. It's kind of confusing because there's another Medicare Supplement open enrollment, the 6-month period. But this is the old disenrollment period. It's from January 1st to March 31st when you can leave your Advantage plan if you want. If you want to leave your Advantage plan, you got one more chance between January 1st and March 31st. Again, critically important, though, that you don't get off the Medicare Advantage plan until and unless you're approved for a Medicare Supplement to take its place. That'll bring you back to your original Medicare with a standalone drug plan. A standalone drug plan that's customized for you and your listed drugs. And that only happens in the following order. If you want a February or a March 1st effective date when the coverage kicks in, we can do that. We just have to put that on the Medicare Supplement application that we want it on. I want my effective date to be February 1st or March 1st or even April 1st we can do. That gives us a lot more time past December 7th. So get your Christmas shopping done. There's no panic. If you want to get off a Medicare Advantage plan and go back to the supplement and original Medicare, we can do that. This is an example because it happened to us. You have a zero premium plan, all right? Zero premium. And in January, let's make it March. March 4th, you call me and you say, hey, I got to get out of this Advantage plan, even though it's zero premium. I pay $50 for doctor's visits, $400 for hospital visits, and nobody takes the plan anymore. So you call me on the 4th. We apply for an Aetna Medicare Supplement, the real deal. When you go to the hospital, you pay nothing. Pretty much just a couple deductible. There's a deductible, but that's it. So we go with the Plan N. You go to any doctor in the United States that accepts Medicare. So we apply for it, all right? That's our first step. Then on March 12th, I get the good news. Aetna approves the policy since you passed underwriting. Okay, so Aetna approves and issues the policy on March 12th since you passed underwriting, because I used my underwriting software and made sure that based on your health conditions, we found the one company, Medicare Supplement company, that's friendly with diabetes. Let's say you got diabetes. I got you a real low rate with a company that accepted you even though you have diabetes. So remember, Advantage plans always end the last day of the month, and then your new plan starts the first of the month. Same with drug plans. So we spend the time, and I type in your drugs, and we identify a drug plan that fits your needs based on the medications you take. Unlike the Advantage plan, where they get a little cookie cutter, plain vanilla drug plan that doesn't cover any brand names, and they toss that in your Advantage plan and say, guess what? We got a zero premium per month plan, and it includes drug coverage. Well, who cares if it doesn't cover any of the drugs you take? So we're excited. We enroll in a Part D drug plan with Silver Scripts, and we don't have to call Humana. We don't have to call Humana and cancel, because at midnight on the last day of the month, that drug plan kicks in. That drug plan kicks the Advantage plan out. Because remember, Washington, D.C., you can't. They decided years ago that you can't have an Advantage plan and a drug plan. You can have either or. So the drug plan kicks out the Advantage plan, and on March 12th, the policy's issued. And I was smart. I said, I don't want any money taken out until the effective date, April 1st. All right? So once again, March 4th, we applied for a supplement. March 12th, we got accepted. On that same day, we enrolled in a Part D plan that automatically kicks the Advantage plan out on the last day of the month. So on April Fool's Day, April 1st, you're not a fool. You got a supplement. You got a drug plan that fits your needs, and we are good to go. Call me before you decide to do anything. Look, I spend thousands on underwriting software. We got 3 different underwriting, Medicare Supplement underwriting technology software. I get licensed with just about all the Medicare Supplement carriers. I spend at least 200 hours a year on Medicare education, Medicare certification. I got reappointed with the majority of supplemental carriers. I get reappointed with a majority of companies in Part D drug plans and Advantage plans. We help with denied claims, wrongful billing, and pre-authorization requirements. We have an in-house Social Security disability attorney. She's my girlfriend. She's in the house. She's sleeping now. But Medicare's my niche, and I've helped thousands of people over the last 10 years. I specialize in one thing. I'm able to save my clients thousands now and in the future. All right? Okay, and finally, how do we proceed? So if you want more information, I would recommend just call me, 843-227-6725. Or you can email me at chris@mayrivermedicare.com. If you'd like, you want a free quote for your age and where you live, go to my website, www.mayrivermedicare.com. Simply type in your age, your marital status, because they do give up to 12% discounts on that, whether you use tobacco or not, and which letter plan. I would type in the Plan N. The G is going to be way overpriced soon. Plan N, and type in your zip code. Within seconds, all the companies in your area, all the Medicare supplements, all the letter plans are going to pop up with rates and financial stability. And you know what? I'm one of the only companies in the United States where when you get a quote on May River Medicare, it gives you the company names and it gives you the financial stability. And the thing is, you could go direct through a carrier. But I think after we've gone through all this, you're not going to want to. You're going to want someone that's going to be with you for 10, 20 years, all right? You guys have a great day. This is Chris Dewey at May River Medicare. Bye-bye.